Chapter 1, EMS Systems. The National EMS Education Standard Competencies for this chapter, preparatory, applies fundamental knowledge of the emergency medical service system, safety, well-being of emergency medical technician, medical, legal, and ethical issues to the provision of emergency care. Basically, the first module is an introduction to what an EMS system is, who are the persons that work within that system, what are the laws that govern operation of that system, the human body, lifespan development, lifting and moving, a team approach. So it's an introduction to what an EMS system is. We'll be looking at an EMS system. We'll be looking briefly at the history of EMS. We'll be looking at roles and responsibilities, professionalism of EMS personnel, and quality improvement and patient safety. We'll talk a little bit about research, impact of research on emergency medical responder care, data collection, evidence-based decision-making, public health, which uses simple knowledge of the principles of illness and injury prevention to emergency care. And introduction. The text is the primary resource for the emergency medical technician or EMT course. So emergency care of the sick and injured, the 12th edition, is the primary text that will be used for this course. EMS is a system, so it's a organized system. And chapter 1 is going to discuss the components of this system, the most important components. Now, course description. EMS is a system. It's an organized system which receives emergency calls, and there is a dispatch system in place. The dispatchers receive information regarding emergencies. Based on the information received, the most appropriate emergency response is determined, whether that's fire, ambulance, or special rescue. And that ambulance response can be BLS in nature, basic life support, or it can be advanced life support, depending on the nature of the call. So EMS system, a team of healthcare professionals provides emergency care and transport. It is governed by state laws. After you complete this course, you are eligible to take either the National Registry of EMTs exam or your state certification exam. And this applies more to the states. For you to be able to do the National Registry as an EMT in Jamaica, once you complete this course, you would have to do a bridging program. And there are a few available. That bridging program will allow you to go through skills and maybe an exam, and based on your performance, you would be cleared to sit the National Registry. The National Registry is for persons who are planning to migrate from Jamaica. If you're not planning to migrate to work elsewhere, then the National Registry would not be appropriate because there are certain things that must be done to maintain that. in the states, the National Registry is required to move from state to state. Most states will have their state certification or state license. But if a person is moving from one state to another, they would be required to have the National Registry. Now, most states have 4 training and licensure levels. You have the EMR, EMT, AEMT, and paramedic. These are the 4 main providers within an EMS system that fall under the Department of Transportation curriculum. There are levels outside of that, but they are not standardized. So you have critical care paramedics, you have emergency practitioners, you have paramedics that go on to become PA, physician assistants, but these are not standardized. An EMR has very basic training, provides care before ambulance arrives, and may assist in the ambulance. So an EMR is the first medically trained person to interact with a patient in the field. This can be a police officer, it can be a firefighter, ski patrol, park ranger. They are trained to provide basic life-sustaining skills until an ambulance arrives. The most important thing for you to note is that the EMR functions outside of the ambulance. An EMR does not function in an ambulance. For an EMR to be on the ambulance, that must be a request from an EMT or higher. So they can assist an EMT or higher on the ambulance, but primarily the function is outside of the ambulance. An EMT is the next level. An EMT has training in basic life support, and the common misconception is that BLS, when we hear the term BLS, we think about CPR and the use of an AED. BLS response, as it relates to EMS response, is much wider than that. So an EMT has training in basic life support or BLS. And some of the skills include the use of an automated external defibrillator, airway adjuncts, assisting patients with certain medication, assessing, and providing spinal motion restriction for a patient with head trauma or spinal injury. Now, the EMT is the first level of responder to function primarily in the field and on an ambulance. So this is the provider that provides assessment, stabilize issues detected in the field, package the patient, put the patient in the back of the ambulance, continue care until the patient reaches the hospital. So the EMT functions in the field and on the ambulance, but it's specifically a BLS unit. So if it's only EMTs on it, it's going to be a BLS response. It is the level that we have most persons trained at worldwide, including Jamaica. So most of the responders in Jamaica are EMTs. It's the most important level of ambulance providers because this is the level that we cover the fundamentals. This is where you learn the foundation of pre-hospital care And if you want to become an advanced or a paramedic, you must be an EMT first. It is also the most disrespected level. An EMT once said to me that EMT is like a spare tire. You don't really value the spare tire until it is required. So unfortunately, that's how EMTs are perceived. And this perception is also the case for paramedics, because sometimes as paramedics, we forget that we were once EMTs. But it is the most important level, because regardless of your level of training, everything starts from basic care. If your basic care is not good, nothing else matters. Now, after so we have the EMR, we have the EMT, and we have the AEMT. Now, AEMT is an EMT who has received specific aspects of advanced life support, or ALS. So they are able to do IV access, they can give certain medications. There are limitations on that though. And they can utilize certain advanced airway equipment. Not many persons are trained at this level. Most persons tend to move from EMT to paramedic. The final level is the paramedic. A paramedic has extensive ALS training, including all the advanced airway procedures for pre-hospital setting, endotracheal intubation. They cover extensive emergency pharmacology. They can do dynamic and static cardiac monitoring, and they have advanced assessment and treatment skills. So that's the 4 main levels of providers. That's something that you need to know. EMT course includes 4 learning activities: reading assignments, lecture presentations, and classroom discussions. There will be step-by-step demonstrations when we get to the skills. You'll have a summary or skill sheet that you will use as a guide for each skill. And we will do case presentations and scenarios. EMT training, focus and requirements. EMTs are the backbone of EMS system in the United States. EMTs provide emergency care to the sick and injured. Requirements differ from state to state. General requirements to be an EMT are high school diploma or equivalent, proof of immunization, successful completion of a background check and drug screening, valid driver's license. Successful completion of required courses and certification exams. Demonstration of the mental and physical abilities necessary to perform the job. Mental and physical abilities. So you must be able to deal with pressure. That's going to be very important, which you will learn eventually. So you must be able to focus under pressure, and I will pressure you. So expect that to occur. And you must be able to physically manage the demands of the job. It is a physical job. Compliance with other state, local, and employer provisions. Now, licensure requirement, and not every state will offer a license. Some states just offer a state certification. Americans with Disability Act, ADA, prohibits employers from failing to provide full and equal employment. Title I of the ADA protects EMTs with disabilities who are seeking employment. It may require modifying the work environment or how the job is performed. And of course, you're going to be doing some background checks. Right, so the first section of the chapter really focus on the provider levels and course requirements. Let's look a little bit now at the history of EMS. So overview of the EMS system, history of EMS, and the origins of EMS is from the war, World War I, World War II, and the Korean conflict. In World War I, they had volunteer responders or ambulances. In World War II, that evolved into a field medic, someone who could provide assistance to injured soldiers in the field. In the Korean conflict, it became more sophisticated, where there was a field medic, there was a field hospital, and they had evacuation available. But while this was occurring in the war, this is not how it was in the States back home. There was no structure to EMS in comparison to what existed in the war times. And a research was done. So in 1966, the accidental death and disability, the neglected disease of modern society, established EMS. So this was a research that was done, and basically what the research showed is that a lot of persons were dying back home in the States in motor vehicle accidents in comparison to the persons that were dying in the war. So they realized that something needed to be done and a structure was necessary, formal training was necessary, things needed to be standardized and properly regulated. And so EMS in the States began. And this is a paper that you can find easily online. If you have some time, look it up and read it. Not a requirement for the course, it's just additional information. In the early 1970s, the Department of Transportation published the first EMT training curriculum. In 1973, the Emergency Medical Services Act was passed, and in 1971, AAOS published the first EMT textbook. So national standardization efforts are as a result of the 1970s DOT National Standard Curriculum. In the 1980s, advanced level of EMTs was introduced. The 1990s, the National Highway Traffic Safety Act, EMS Agenda for the Future, came out. And in 2019, EMS Agenda for 2050 came out. And as I said, these things can be located online. If you want to get some additional information, feel free to search for them. Now, levels of training. You have the federal level, which dictates the national EMS scope of practice model, providing guidelines. Now, scope of practice. As a EMS responder, you will have to be familiar with what is meant by your scope of practice and your standard of care. Now, the scope of practice is what you are allowed to do at your level of training. So the scope of practice is what you are allowed to do. EMT can put in basic airway adjuncts based on their scope of practice. An advanced EMT can start an IV and give certain medication based on their scope of practice. A paramedic can do dynamic cardiology or static cardiology and certain invasive procedures based on your scope of practice. So it's what you are allowed to do based on your level of training. The standard of care is how well you execute the skills that you are allowed to perform at your level of training. So as an EMT, your scope of practice allows you to put in basic airway adjuncts if they are indicated. The standard of care would be the steps that you follow to put in the airway adjunct, and the steps that you follow anywhere you go in the world as an EMT, that is the way it is done. That's the standard. If you fail to execute a skill at your required standard of care, or if you execute a skill that is outside your scope of practice, that would be considered negligence, and you can get in legal problems for that. So at the federal level, you have the National EMS Scope of Practice Model, which provides guidelines. At the state level, you have laws that regulate EMS operation. At the local level, you have the medical director, which provides oversight and support. Now, public BLS and immediate aid. Millions of lay people are trained in BLS and CPR, and automated external defibrillators or AEDs are used by lay people. This is very important because there's a system that is activated and certain things must be in place for the system to be effective. So if someone witnesses an emergency and contacts EMS or activates EMS, if that person is trained in basic life support or CPR and it is necessary, they can initiate that while EMS is en route to the location. Also, the dispatcher has medical training to guide that person, so they can guide the person, because most persons who have done any type of first aid or CPR stuff, if you're not doing it on a regular basis, if it is necessary all of a sudden, you're not going to be doing it well, or you might not remember everything that you need to do at that point. And that's where a dispatcher with proper training comes in and is very valuable, because they can guide the caller if necessary. In certain public spaces, AEDs are available, so if someone collapses, a layperson can access a AED, turn on the AED, follow the instructions. The more persons we have trained, the better. Unfortunately, in Jamaica, we have persons trained, but the quality of training is concerning. So persons have been trained in Jamaica, but the quality of that training leaves much to be desired. A lot of the first aid courses that are done across the island don't emphasize the quality of the training. So persons are being certified and they really can't do anything if something should happen. So I believe the training, the first aid training, the CPR, stuff like that, that is being offered across the island needs to be standardized. It must be standardized. So regardless of where you did your CPR first aid, if you come from east and this person come from west, how you control bleeding for a person that is bleeding significantly should be the same. There shouldn't be a difference. And that is a big problem in Jamaica. The other thing that is an issue is there's no formal dispatch system. So we don't have a national dispatch system. If you need an ambulance, it's gonna be dependent on your location. So depending on your location, you might only have access to a private ambulance. Depending on your location, you might only have access, to the fire brigade ambulance response. So it's gonna be based on your location. And for the fire service specifically, you have to have the direct line to that station. And for the private companies, you're gonna need to have that company's number if you're gonna call them. So there's no central dispatch, and that is an issue because again, if a lay person has done any type of first aid or BLS training, if it is not something that they're doing on a regular basis, if the need arises, they won't be able to do it properly. So it's important that if they call for a response, EMS response, somebody is able to guide them to pull that information out so that they can do something, especially where bleeding control is concerned. That is a major issue in Jamaica. All right, now emergency medical responders include law enforcement officers and firefighters. They initiate immediate care and assist EMTs on their arrival. Focus on providing BLS and urgent care with limited equipment. And this is also very important. If someone is going to be taught about first aid and CPR, they must know the role of an EMS response. What is the role of EMS? So if you are functioning as a first aider, because you did a course at wherever, they should know what is the role of EMS and how they can assist these responders when they arrive on location. Emergency medical technician. EMT course requires about 150 to 200 hours. Our course usually gives students, I believe, over 300 hours. The EMT has knowledge and skills to provide basic emergency care. The EMT assumes responsibility for assessment, care packaging, and transport of the patient. Then we have the advanced emergency medical technician. Training adds knowledge and skills in specific aspects of ALS, including IV therapy, advanced airway adjuncts, administration of limited number of medication. Then we have the paramedic. The paramedic has extensive training. They cover 1,000 to more than 1,300 hours in the classroom and in internship. Training covers a wide range of ALS skills. And currently, PHEMS offers the EMR, EMT, and AEMT programs. Now, the paramedic course can be completed in a year, it can be completed in 2 years, it can be completed in 3, can be completed in 4 years, depending on whether a person is doing a certification, an associate degree, or a Bachelor of Science. Regardless of the length of the time that the paramedic program can be completed, within the first year, a paramedic student will cover all the skills that they need to learn as a paramedic. The degree programs is really for paramedics that want to branch out of EMS and go into another area, whether that's nursing, medicine, or wherever, physician assistant. But it's usually when they require credits to transfer to other programs. Now, components of the EMS system. 1, comprehensive quality, convenient care. 2, evidence-based clinical care. Efficient, well-rounded care, preventative care. Comprehensive and easily accessible patient records. So records keeping is very important. That's a sore area in Jamaica as well. Now, public access, 911 system, access public safety, and I kind of touched on this earlier. So a central dispatch system is important to EMS operation, extremely important. If you don't have a central dispatch system, there's going to be a delay in how EMS is activated and how long it takes EMS to get to that person. Dispatchers obtain information and dispatch resources. So the dispatcher will determine what type of response is needed. And as I stated previously, it can be fire, police, and ambulance, or it can be all 3. Emergency medical dispatch system provides medical instruction. I mentioned this earlier. So they are trained to provide guidance to the caller, to provide certain life-sustaining skills that may prove to be very valuable for the patient. Mobile apps assist with layperson CPR and AED location. Now, human resources focuses on people who deliver care. EMS Agenda for 2050 encourages an environment where people want to work. Demotivation in EMS is a major problem in Jamaica, and it can be linked to various factors, job satisfactory, lack of resources, lack of proper regulation. Numerous factors can affect this. But what I do know for sure, or what I would say is, if you're at a point where you're not doing it to the best of your ability, or you don't feel like you should be doing it to the best of your ability, then it might be time for you to move on to something else. Because at the end of the day, it is an individual's life that we're talking about at this point. And that individual has a family. So the consequences of that person not getting proper care can have long-term effects on their family and friends. So if we're not going to do it to the best of our ability, then it might be time for us to walk away. Now, medical direction, physician medical director. The EMS responders operate on an extension of the medical director's license in the field. So a medical director is responsible for online and offline medical direction. So the medical director writes protocols and standing orders that EMS responders will follow based on the type of patient they interact with in the field. The medical director is also available on a direct line if the EMT has exceeded the standing orders. So what I would call gray areas. When you have a gray area, you need to contact your medical director. So we do not function independently. We function under the medical director's license or as an extension of the medical director's arm in the field. And the requirements to be a medical director, it must be an ER physician, so it must be a consultant, and this consultant must have EMS training, whether they were a paramedic or EMT, or they have done some type of training in EMS. They must know how an EMS system operates before they can be a medical director. That's the requirement. No EMS system, absolutely no EMS system should be operating without a medical director. Any system that is doing that, it is operating illegally. So, physician medical director, authorized EMTs to provide medical care in the field. Medical director acts as a liaison with other medical professionals that EMS responders will interact with. They are responsible for standing orders and protocol. They describe appropriate care and establish medical direction for providers. Now, a medical director can limit your scope of practice, so they can restrict what an EMT is allowed to do in the field, but they cannot expand it. Very important. So a medical director can restrict what an EMT or any responder is allowed to do in the field, but they cannot expand their scope of practice. So a medical director cannot tell you as a responder to do something that you are not authorized to do once it's outside your scope of practice. Medical control can be offline or online. So offline, indirect, that's your standing orders, training, supervision. So a simple example of offline, a patient is found to be in a code state, so they are not breathing, you're pulseless, your standing orders say you should do CPR and use an AED for the first 6 minutes of that code. So that's a standing order. Online medical direction, as I said, this is where you have gray areas. So it's not clear what you need to do at this point. An example of that, you have a patient that requires airway positioning. You have utilized a jaw thrust, which is indicated, but it's not effective. And the patient is a patient that is at risk for spinal injury. This is a situation where you may have to contact your medical director and get some guidance. So you would call your medical director and let your medical director know that you have a patient with possible spinal injury. Patient requires airway positioning. You have attempted a jaw thrust, but it's not effective. guidance is required at this point, or permission to do a control head tilt chin lift. So that's your offline and online. So online, the responder is speaking directly with the medical director. Offline, it's a written document, a standing order, or based on your training or based on supervision. Legislation and regulation. Now, training protocols and practices follow state legislation. Again, we cannot go out there and just do as we please. We're guided by laws and regulation. Senior EMS officials handles administrative tasks, scheduling, personnel, budgets, purchasing, vehicle maintenance. Integration of health services. Pre-hospital care is coordinated with hospital care, so they both are intertwined. Neither is better, so there is no comparison, and there should be no comparison between a EMS responder and a nurse and a doctor. It's two different fields of practice, so neither is better, both are important. So the EMS responders provide the initial care, the initial life-sustaining care, and then the nurses and doctors build on that in the hospital setting. If the pre-hospital care does not exist, then when the patient gets to the hospital, the nurses and doctors will now have to initiate the pre-hospital care that should have been done prior to the patient reaching their facility. Pre-hospital care is continued in the emergency department, so it's continuous. Integration ensures comprehensive continuity of care for the patient. So both pre-hospital and in-hospital must work together. It can be that there is poor communication between the EMS responders and the hospital staff. That's going to cause problem for the patient long term. Mobile integrated healthcare. This is a method of delivering healthcare that utilizes a pre-hospital spectrum. And it's really for persons with chronic illnesses that may need certain type of treatment on a daily basis. So you have paramedics now that are trained as community medicine paramedics that they basically go out to these patients, ensure that they're taking their medications as they should, and if the need arises for them to get emergency transport, they have a paramedic available. It's the future of EMS. Evolve with the goal to facilitate improved access to healthcare at an affordable price. Healthcare provided within the community by teams of professionals. So instead of this person have to go in an ambulance and go to the hospital to get certain treatment, it's cheaper to bring a paramedic to that patient. As I say, that's the way forward. That's the future. MIH created additional training levels for EMS providers, including community paramedicine. So this is a new certification that is available. So you have tactical paramedicine, you have community-based paramedicine, and you have critical care paramedicine. These are additional certifications that paramedics can now acquire. Paramedics receive advanced training to provide services within a community. Community paramedics provide additional services. Information system. Computer systems are used for documentation of patient care. Electronically stored information can be used to improve care. So data collection is important. Evaluation. Medical director is responsible for maintaining quality control, adapting a just culture, promotes a learning culture that holds employees accountable for behavioral choices by balancing fairness and accountability. So fairness and accountability is very important, and it is something that is lacking in Jamaica. There's no accountability, there's no standardization, there's no regulation. So because of that, anybody can buy a bus and put ambulance on it, and they have a link in the Ministry of Health and get that cleared, and it start to respond on the road saying that they're offering EMS response, but it's below the standard of care because there is no accountability and no regulation. A lot of persons are out there working without a current EMT certification, and they are very comfortable doing this. Because there is no regulation and accountability, a lot of persons are out there working and telling persons that they are EMTs when they have never done a course, because there's no regulation. Because there's no regulation and accountability, there are persons who have done or claim in quotation that they have done EMT training, but the training that they got was way below standards. So this is a major problem in Jamaica, and if it is not corrected, we're gonna get to the point, and I would say in the next 5 years, if we don't fix this issue, we're gonna get to a point where we don't need ambulances in Jamaica, or we don't need EMTs in Jamaica, because they're not gonna do anything for a patient. So it would be safer for a person to put somebody in a vehicle and take them to the hospital than wait on an EMT, because you're not gonna get an EMT that is at the required standard. That is something I see happening 5 years from now, maybe less. Now, continuous quality improvement. Reviews and performs audits of the EMS system to identify areas of improvement and or assign remedial training. Minimizing errors is the goal. Use a plan, do, study, act, cycle. Plan, do, study, act, cycle. Patient safety. Minimize medical errors that occurs as a result of rules-based failure, a knowledge-based failure, or skills-based failure, or a combination. Now, in order to avoid errors, you have to stay up to date. I don't have to overemphasize that. If you're not up to date, you're gonna make errors. If you don't have proper medical direction, you're gonna make errors. No EMT should be operating on their own. They should be operating under guidance. And as an EMT, you have a responsibility to your patient, right? You have a responsibility to your patient. So if you're gonna go out there and interact with people, ensure that you are at the required standard. You shouldn't be touching people if you're not up to date. I cannot understand that logic. So I don't want a nurse that is not up to date with their license touching me, and I certainly don't want a doctor So as a paramedic, it is my duty to my patient to ensure that I am up to date with what is happening in my profession, that I can provide the best level of care to my patient. I don't know why that is so difficult for EMTs in Jamaica to understand, right? And the problem with Jamaica is we like favors. We have a favors culture in Jamaica, and that is our biggest problem as a country. We don't like to do things the right way. Everybody wants an easy way out, and it does not work out long term. And that is why we're having issues with COVID right now. There's no easy way out when it comes to EMS. If you find an easy way, your patient is going to suffer. And if you don't care, if your patient suffer, then you shouldn't be in EMS. So if it's okay for you to function out there and you're not up to date, what are you doing in EMS? You shouldn't be in EMS. So these are major problems that we continue to have in Jamaica. And I will see it with this group, and I have seen it with other groups. So I've trained a majority of the EMTs in Jamaica. I have trained them. Every 2 years, some return for recertification. And that's where I know if a student, a former student, takes what they're doing serious. Most of the persons that are coming back for recertification, they can't pass a recert, which is crazy. It is absolutely crazy. You cannot be working in a field and all you have to do is come and refresh what you learned 2 years ago and do an exam and some skills and can't pass a recert. That's ridiculous. So what have you been doing out there for those 2 years? This is a major problem in Jamaica. System finance. Finance systems vary depending on the organization involved. Personnel may be paid, volunteer, or a mix. And in Jamaica, we have private and we have EMS response within the fire brigade. And there are industrial setting, which is a bit different, but the two main response is going to be private and the fire. For private, you have to pay for that service up front. For the fire brigade, you still kind of pay for it in your taxes. So if you're paying taxes, you're supposed to get an ambulance if you need one. A lot of people don't know that. So if you're a taxpayer, it is the government responsibility to ensure that if you need an ambulance with trained EMTs, that is available. So you don't have to pay upfront for the fire service EMS response, but as I say, if you're paying tax, you pay for it. EMTs may be asked to gather insurance information, secure signatures, obtain permission from patients to bill insurance. In 2020, the Centers for Medicare and Medicaid Services implemented a pilot program called Emergency Triage, Treat, and Transport, ET3. Reimburse EMS systems for providing the right patient care at the right time, set up a payment model for patient transport to alternative destination. Education system. EMS instructors can be licensed in most states. In some states, they just require a state certification. Most EMS training programs must adhere to national standards. So there must be a standard for training program, just like how there is a standard for delivering care in the field. Continuing education, refresher courses, computer-based or mannequin-based self-education exercises. Continuing education, very important. Refresher courses, every 2 years, you're required to recertify. If you're not recertified, you shouldn't be touching patients. And it is your responsibility as an EMS provider. So it's not your company's responsibility, it's not your organization's responsibility. It is your responsibility. So if you're gonna be remaining in the field, it is your responsibility to stay up to date and ensure that your certification does not lapse. You owe that to your patient. These measures intend to maintain and update an EMT's skills and knowledge. And in the States, every 3 months. So in the States, if you're working with a service, every 3 months, you have to do a protocol exam. That is a requirement in the States. If you're not able to pass that protocol exam, you're pulled from the field and you're placed in a classroom to make up for whatever shortcomings you have, and your pay is cut. So your pay is gonna be cut. That's how serious they are in the States. Now, prevention and public education. Prevention and public education, 2 components of EMS system which focus on public health. Very important. So the general public in Jamaica has no clue. I mean, it's not that bad now, but they still don't have any idea of what the role of EMS responders should be. And it's really, I wouldn't say it's a government responsibility. I would say the government has a role to play, and the organizations that offer EMS response also have a role to play. So government needs to educate the public, but I don't think that's something that the government would engage in, because if the public becomes more educated as it relates to what is required, then they're going to expect that that should be available. And we don't want that right now. Now, for the organization, you have a primary service area that you provide EMS response for. It would benefit your organization to have meetings with persons in that community or primary service area and let them be aware of what it is that you will be doing as responders and how they can assist you to do your job better. It would make life easier for that organization. But I can only talk at this point. So emphasis on prevention, right? So as it is our responsibility to go there and educate people. The more people are educated, the easier your job will become. EMS works with public health agencies on prevention and primary prevention and secondary prevention. Not gonna go too much into that. Now, examples of public health accomplishments: vaccination programs, helmet laws, sewage system, formation of the Food and Drug Administration, clean drinking water, seatbelt laws, tobacco use laws, restaurant inspection, prenatal screening. One of the things that we can look at in Jamaica is teaching the public how to control bleeding. As I said, that's a major problem. A lot of persons are bleeding to death before they get to the hospital. So maybe some public health research, health needs assessment can be done, and maybe something worked out where we can start teaching the public how to control bleeding. Now, EMS research. Not gonna go too much in this portion of the chapter. It helps determine the shape of EMS. Evidence-based medicine is the way forward. So back in the days, a lot of what was done in EMS, there wasn't much research done to determine if it is really beneficial to the patient. As we move forward, everything that is now being done in EMS is guided by research. So it's evidence-based medicine. Many EMS systems and states consult the national model, EMS clinical guidelines for National Association of State EMS Officials based on review of current research and expert consensus. In Jamaica, there's not a lot of research in EMS, if any at all. Very few research has been done, and I believe we need some more research in EMS because research will bring forth the issues that cannot be ignored, especially if it's costing the government money. And I know the government is spending a lot of money where emergencies are concerned from a field perspective, especially with trauma patients. Now, roles and responsibilities of the EMT. They are required to keep the vehicles and equipment ready and ensure safety, be familiar with emergency vehicle operation, provide scene leadership, perform scene evaluation. They are required to recognize the need for additional resources and request these resources. They are may be responsible for gaining access to the patient, definitely will be responsible for performing a patient assessment, give emergency medical care while awaiting additional medical resources, give emotional support, maintain continuity of care, resolve emergency incidents, uphold medical and legal standards, ensure and protect patient privacy, give administrative support, constantly continue professional development, very important, cultivate and sustain community relations, give back to the profession. Now, professional attributes, integrity is going to be important, empathy is going to be important, intrinsic motivation or self-motivation. You cannot be an EMT that grow if you don't have intrinsic motivation. That is extremely important in order to excel in EMS in Jamaica. Appearance and hygiene, self-confidence, and that will build over time with experience. Time management, extremely important. So you have to be able to manage your time efficiently. Time is going to be very important to this course. Time is going to be very important to your career as an EMS responder because you're required to arrive at least 15 minutes prior to your shift beginning to check off important stuff. Communications, your ability to communicate with your fellow co-workers and the patient, extremely important. How you communicate with a patient is going to be essential. Teamwork and diplomacy is going to be also very important. So you must be able to interact with your co-workers without being unprofessional in your conduct. Respect, patient advocacy, careful delivery of care, Every patient is entitled to compassion, respect, and the best care that can be afforded to them. Always act in the patient's best interest. Do no further harm to your patient and act in good faith. EMTs are bound by patient confidentiality. Be familiar with requirements of the Health Insurance Portability and Accountability Act. And that would be the end of chapter 1. Let me stop this.